Goeiedag, good day, fellow South Africans and citizens of the world. Well, I've just been listening to a very interesting speech in the Press Council of Australia by Dr. Omar Khorshid, who is the president of the Australian Medical Association. Why is it so interesting? I'll tell you. One, he's advocating everybody gets vaccinated. Two, he is advocating that there are penalties for those people who refuse to get vaccinated. Let me just play you a little extract and then we'll talk about this a bit further.
What is your message to state and territory leaders who have rejected the notion of a vaccine passport? And is there any medical reason why fully vaccinated people should not be given exemptions from restrictions and border closures during breakouts?
So on your first question, we are certainly supportive of Australians being able to demonstrate their vaccination status. That is going to be required in our future. We're not entirely sure how and when just yet, but for you to get on an international flight, it's pretty hard to imagine you'll be able to do that without being able to demonstrate your status. So the information is available right now on the Australian Immunisation Register. It's linked to your My Health record, and it's easy to create a specific app that allows access to that, and we'd certainly encourage governments to do that, and then encourage state governments to use that information in whatever ways they're going to be setting up their societies post-COVID or once we're actually fully vaccinated.
You heard there Dr. Khorshid clearly advocating the idea of a vaccine passport before you can travel. Now, he also says in the same breath that having the vaccine does not mean that you're not going to get COVID-19. You know, there is an incredible disconnect going on here, guys. In America, Dr. Death, also known as Dr. Fauci, is saying that if you don't get vaccinated, you need to wear a mask. But if you have had the vaccine, you don't have to wear a mask. You see how people are being penalized for not following somebody's line when it comes to the jab. I'm going to play you the full, well, it's not the full, the relevant extracts from that press club conference meeting where Dr. Omar Khorshid, the president of the Australian Medical Association, answers questions related to COVID-19, the vaccine, and how you penalize people who refuse to take the vaccine. Here it comes. Please remember to register on lovinglifetv.com. This is the platform we are transforming to because of Censorship City. There's so much more I could have said about this, guys, but I can only do it on my new lovinglifetv.com platform. And if you go there, you'll see a whole lot more information on this subject, which I can't put up on YouTube. Okay? I've been there, done that. I've had so many medical misinformation strikes, you can't poke a stick at them. That's why we are getting out of YouTube and we're moving to our own platform. And I'd encourage you to register on that new platform. Please remember to like this video. Please remember to share this video. And above all, please stay safe. Bye for now.
Thank you very much, Dr. Khorshid. There was plenty there in that speech. We'll go to questions in a moment. In fact, I'm going to skip a question, so whoever wants to get ready to ask. But I am going to say something before we go to questions, which is an oversight on my part. At the very beginning, I forgot to mention some of the people that we've got in the audience, including the Chief Medical Officer, Professor Paul Kelly, the Deputy Chief Medical Officer, Dr. Michael Kidd. We've also got the Vice President of the AMA, Chris Moy. Thank you for being here. And thank you to other medical experts I can see in the audience that I won't name because I don't want to miss anybody out. But there's never been a time when it's been so important to have medical commentary on what Australia and the world is going through, and I thank every medical expert who's in the room today. And after that, I will now go to our first Krishani Danji from SBS.
Krishani Danji, SBS World News. Dr Khorshid, last week Prime Minister Scott Morrison announced Lieutenant General Fruin would lead a new COVID vaccination task force. He follows Commodore Eric Young's appointment as head of the Vaccine Operations Centre. What does this change with the involvement of the military mean for the rollout? What impact could this have? And do you think it should have been done earlier?
Yeah, thank you for that question. I think the appointment of these senior military leaders to critical positions in the vaccine rollout is a sign of the government's need to make sure we are doing everything we can to make the rollout smooth, to make it efficient, to get the vaccine into the arms of Australians. There's no point having it in warehouses around our cities. It needs to get out into the community, and there's a huge logistic task around doing that. So I think it's a recognition of where we've been, where we need to go. I think the military are probably a lot better at logistics than the health department is, and that assistance, I'm sure, is being gratefully received.
Thank you. Our next question is from Greg Brown of The Australian.
Greg Brown from The Australian. I just wanted your view on the Victorian government's handling of the latest COVID outbreak. Regional Victoria had a week of a hard lockdown without any new cases. Melbourne had 2 weeks of a hard lockdown, and after only one new case today, there's still pretty heavy restrictions on people. No visitors, no gyms. Melbourne and regional Victoria are divided. Do you think the response in this particular outbreak was proportionate or draconian?
We are learning along the way with this pandemic, and what Victoria is saying is our first significant outbreak of the Kappa variant and, of course, now the Delta variant, things that we haven't seen in Australia before, and they have to take precautionary measures. Having watched what has happened overseas, having learnt from that, they have to do what they can to protect Victorians and, of course, the rest of the country as well. So the AMA has been supportive of the actions of the Victorian government. I think the public expects to be kept safe, and this is what is necessary, to be kept safe when we're in an evolving situation. Now, of course, as information comes in, things become clearer, decisions actually become easier to make, and I think the best thing for us all to do is support the advice that's been given by the chief health officers around the country. They're doing their best to protect us all, and what every Australian can do, what they have in their own power, is to go and get vaccinated. That is the thing that will, if you don't like lockdowns, go and get vaccinated. If you don't like border closures, go and get vaccinated. If you want to travel internationally, go and get vaccinated.
Scar from the West Australian.
Lani Scar from the West Australian. Thank you so much for your address. From Thursday, WA will open up its vaccines to over 30s. Should other states and territories be looking to do that? And what are your thoughts around the level of vaccine hesitancy still in the community? How do we combat that? Would one way be opening up vaccines to anyone who wants to get it so that we do have a higher rate of people being vaccinated in Australia?
Thanks for the question, Lani. It is a complex area because we have this constraint on supply. And right from the start, our experts, the ATAGI committee and our National Cabinet agreed to priorities for the vaccine rollout, focusing the rollout on those at highest risk of contracting COVID or those at highest risk of harm if they get COVID. So your frontline workers, people living in residential aged care, disability care, etc. Now that job is not yet done. We still have significant numbers of elderly Australians in residential aged care who are not vaccinated. We still have enormous numbers of aged care workers who are not vaccinated, and a lot of Australians over the age of 70 who are not yet vaccinated. So that has to be our priority group if we are to limit the impact of any outbreak of COVID in the community. Now, to your question around if we open it up, will it improve public confidence? It probably will, and I think that's the decision that the WA government have taken apparently on their own in the last couple of days, and it'll be interesting to see what the impact is in Western Australia. But our call is for all states and governments to finish their high priority people because they are those at most risk. They must be our priority. Those between the ages of 30 and 39 are not a high risk group. And if we did get an outbreak in Australia, the chance of someone in that group ending up in hospital on a ventilator with COVID is actually very low.
There are estimates that in order to protect the population, we're going to need a vaccination, or to get more than 80% of the population vaccinated. Do you see that as a realistic target? And do you think that in order for the community to benefit as a whole, that vaccination is going to have to be mandatory, compulsory for many people in the community, depending on perhaps their work?
Yeah, so we don't know enough about the vaccines and enough about the various types, variants of this virus to know what proportion of the population needs to be vaccinated with which vaccine to achieve true herd immunity. But that's not really the aim here. The aim here is to protect Australians from ending up in hospital with COVID. That's been very clearly enunciated by our Chief Medical Officer, by our governments around the country, and that should be still our primary aim.
Thanks. Next question.
Thank you. So on the first question, the AMA is certainly supportive, and I am supportive of there being a tangible benefit for Australians who've been vaccinated. And that's been a difficult thing for our chief health officers to discuss, because they have been absolutely certain as to how much vaccination reduces transmission, but it's a lot. They are very effective with the variants that we know of. And I think for some Australians who are hesitant, who are not sure, or who are just waiting, having a direct benefit such as greater freedoms, whether it be to travel, whether it be crossing state borders, whether it be, as you've described, a different quarantine arrangement, those are things that should be considered by our government as we go forward in this pandemic and as more and more of our population are vaccinated. We need to be a little bit careful that we don't provide freedoms to people who have had access to the vaccine that are not available to those who haven't yet had access. So there's an equity issue there. But I think at the heart there is a significant conversation needed about what a vaccinated population means. Where we should take that further, though, is what does our health system look like once we're fully vaccinated, once we open international borders? And that goes back to some of our pillars, because although we may well have a vaccinated population, the moment those borders go down and people start travelling, we're going to get not just COVID coming into Australia, which we have to learn how to manage, but also influenza again. And when you've got public hospitals that are bursting at the seams with ambulance ramping, it's hard to see how there's any capacity to deal with the surge that we know happens normally every winter. We haven't been getting them at the moment because we're not travelling. We're reasonably well vaccinated against the flu, but probably not this year as much as last year. And we are sitting ducks for not just COVID, but for flu when those borders open. So that's a broader conversation that we'd like to see happening very openly in society.
I saw today you backed a vaccine certificate, but the more substantive vaccine passport has come up with against a lot of opposition. What is your message to state and territory leaders who have rejected the notion of a vaccine passport? And is there any medical reason why fully vaccinated people should not be given exemptions from restrictions and border closures during breakouts?
So on your first question, we are certainly supportive of Australians being able to demonstrate their vaccination status. That is going to be required in our future. We're not entirely sure how and when just yet, but for you to get on an international flight, it's pretty hard to imagine you'll be able to do that without being able to demonstrate your status. So the information is available right now on the Australian Immunisation Register. It's linked to your My Health record, and it's easy to create a specific app that allows access to that, and we'd certainly encourage governments to do that, and then encourage state governments to use that information in whatever ways they're going to be setting up their societies post-COVID or once we're actually fully vaccinated. The second question, I've forgotten.
Well, it's this idea, I suppose, of there's an opposition to a vaccine passport. And is there any medical reason why people with these vaccine certificates should not be exempt from a state border closure or restrictions?
So there are some concerns around the potential that you can be vaccinated and still contract COVID, and that's been shown with a number of the variants. In fact, we have some cases in Victoria right now in people who have contracted COVID who have been vaccinated. However, these people, to my knowledge, have not gotten sick. What we don't know is, can they transmit it to someone else? So if you travel to another state, catch the virus, despite you being vaccinated, there is that chance you could still bring it back to your state, and that's, I think, what state and territory leaders are grappling with at the moment. However, our view is that in Australia right now, with our very limited outbreaks, the chances of you even being exposed, let alone actually contracting it and bringing back if you're vaccinated, are extremely small, and we believe it's a positive policy direction that all state and territory should be considering at this stage to help Australians make that important decision to get themselves vaccinated.